right? And you have voiced concern about the hospitals in New Hampshire being maxed out on resources. Where do things stand right now with the current hospitalization rate?
So our hospital numbers really peaked out in late December. They're still very high, without a doubt, but we have anywhere between 375 to 420 people in a hospital on any given day, on average. And it's been bouncing at that number. It's a very, very high number. I think in our previous surge, the highest it ever got was just over 200, something like that. So we're really double anything we had ever seen before. The issue, if I can just take folks back a little bit, remember, managing COVID as a whole is all about ensuring you have access to your hospital system, all about ensuring that the system does not get overwhelmed. So that's why we focus so much on hospitalizations and fatalities. The other big issue is, I think a lot of folks don't understand, a hospital bed for COVID is not equal to a hospital bed for anything else. And what I mean by that is, when you're in the ICU for COVID, on average, 4, 5, 6 weeks, sometimes for individuals. You can get a quadruple bypass surgery and be out of the hospital in 4 days, right? So this is very different in that there's almost nothing like it in terms of the amount of time an individual takes up that bed. So what I mean really is, when you have one person in a COVID hospital bed, it's really equal to 5 or 6 or 7 people for other issues. And that's why hospitalization of COVID is such an important metric to watch, because it overwhelms the system more than any other type of illness you could get.